with the JOCR, that is the Journal of Ophthalmic Clinics and Research, in conducting these webinars. We have already conducted one webinar, and now the second one. The main intention of conducting these webinars is to bring about awareness to the first year postgraduates as well as practicing ophthalmologists. In these various topics are covered, an overview is given so that postgraduates can understand how to approach and how to write the manuscripts, and they can easily submit their manuscripts. And we have a Journal of Ophthalmic Clinics and Research, and if they consider to give it to us, and we'll also publish them if they go through the peer review. Now, with this, I request our secretary, Dr. Gopal Raj Garu, to say a few remarks and before going to the main part. Thank you. Over to Raj Garu.
Yeah, thank you, Murthy Garu, for the initiative. The first webinar went very well. So many people feedback was it was very useful. So the second one also, the topics are very interesting. I think we are grateful to Bharat and his wife for sparing their valuable time, and then and also thank all the team members of the JOCR for excellent initiative. With this, I think without wasting much time, we'll go ahead with the introduction and then next stage.
Yeah, Sudhira is good.
Good evening, sir. Good evening, everyone. It's a great pleasure to introduce Dr. Bharat, sir. He is currently consultant cataract and refractive services at Bombay Nethralaya, Nimuk. He did his MBBS from AFMC Pune and did his fellowship in cataract and refractive surgery, cornea and refractive surgery from Arvind Eye Care System, Pondicherry. Bharat has keen interest in research and publication. He has published more than 340 peer-reviewed articles in various international and national journals and has reviewed over 500 papers for various journals. His keen interests are microbial keratitis, keratoconus, dry eye, ocular trauma, and lamellar surgeries. Dr. Bharat has won more than 50 awards at various national and international conferences, including the Best Paper at Ophthalmic Society of Kenya, AOS International Heroes Award at 2003 and 2024, 2023 and 24, Best Paper Award at AOS 2020, 21, 22, 23, all 4 consecutive years. AOS MTC Partner, Best of IJO Awards for 2020, 21 and 22 and 23. IJO Award for Maximum Citations of Original Article, ACON International Oration Award 2023, AOS IOSI Essay Writing Competition 2023, First Award, AOS International Travel Grant Recipient 2023. He is winner of Mega Quiz AOS 2023, and he has won free paper in DOS 2021, Best Case Presentation in DOS 2021, Best Paper Award in DOS 2021, Best Paper Cornea and Uvea TNOA 2021. And I would thank him and his wife for sparing valuable time and giving us valuable insight into all the research methodology. Sir, please go ahead with today's topic, sir.
Yeah. I'm audible, ma'am?
Very audible, sir.
Thank you so much, ma'am, for these kind words and kind introduction. And I thank the Andhra Pradesh Ophthalmic Society and Dr. Murthy sir, Sudhira ma'am, Raju sir for this opportunity and to share our experience over this. I'll share my screen for the second. Is it visible?
Yes, yes.
Visible, sir.
Yes. Just a minute. I'll start in a minute. Yeah. As we had our first session of basic aspects of research and publication, now today we'll delve into research methodology and analysis, which is, I must say, a slightly tougher part, especially considering the postgraduate ophthalmology and especially the fellowship area, because of the keen involvement in studies as well as less time devoted to, especially it's a different aspect because of the statistical analysis and all, which we usually study during our MBBS. And after that, we don't have much of inclination. But considering all these things, we should know some basic aspects so that we can understand a paper well, and we can be like very sure that what we are writing or what we are portraying, it's correct or not. So I thank sir for this opportunity. I try to do justice with this topic. It's a difficult topic, but I'll try my best. So, so coming to the overview and introduction to research methodology. So, what is the first of all, when we are doing research, we should define our research objective. Like it should be, we should establish what is, like it should be clear, specific, and measurable research goal to guide the entire process and entire focus. Like suppose we are trying to study some aspect of a disease, so we should clearly like basically which our research question, our research objective should be clear that we are going to study, for example, research visual outcomes and complication after FACO, so that our goal is targeted and specific. Secondly, we should select the appropriate research design, like choose between whether we are dealing with a quantitative data or a qualitative or mixed method based on the research questions and objective, which we go through as we go through the webinar, we'll understand more. And we should also define the sampling as well as population, identify the target population, and select a representative sample to ensure generalizability and relevance of finding. Because suppose if a patient population not presenting to our clinic and we are trying to publish it, we are not going to reach anywhere. So we should understand like what common patients are presenting to our clinic and what we have a good sample size. For example, keratoconus, we have 300-400 patients turning of keratoconus per year. So we have a good idea of present publishing this paper as well as converting into a thesis like that. And we should understand correctly how the data collection methods work. Like we should either we should define like whether we are using a survey or we are going to interview the patients, for example, or we are going to do an observational study of like maybe a retrospective analysis, or we are going to do experiment, suppose a randomized trial, or carefully aligning method with research goals for accuracy. So these are the basic aspects of research methodology. Now, what are the steps involved in this? First is the very important is data analysis. If the data analysis is not correct, then we are not going to reach to a good interpretation or good answer to our research process. So we should apply correct statistical or thematic analysis depending on the data type to interpret result effectively. And a statistician will be very helpful in this process, because we may not be aware of the correct formulas or the correct statistical methods which should be there. So always we should keep some statistician in loop with us so that we can always get good inputs. It works as a partner with us, and we should always take inputs from them. And another important aspect of any study in today's aspect and today's scenario is, as we discussed earlier also, is ethical consideration. So we should define the informed consent, confidentiality, ethical approval for the project from the IRB committee and the participants, and uphold the research integrity. Basically, it means that you should have an informed consent form. It should be signed by each patient before the study, and patient should be willing to participate. Secondly, the IRB approval should be obtained, because if suppose we are doing some intervention which is not correct for the patient, or which is going to harm the patient, that study is going to get rejected. So ethical consideration forms the important aspect of it. Interpretation and reporting of findings. So once we have the data, we should convert it into results, and we should draw meaningful conclusion from the data, linking to research objective and discussion implication. So how this will help us? This will help us to understand our research objective well, whether suppose we are studying the geographical variation of keratoconus in a particular area, like how many are advanced keratoconus, or how many are severe, or how many are early keratoconus. Suppose we are going to study the epidemiology of keratoconus, so we should have correct meaningful data to guide our interpretation, so that we can give some meaningful interpretation to our paper. And review and refinement, critically reviewing the process and finding, addressing limitation, and suggesting areas for further. So a lot of time what happens when we are doing a study, we have taken out the data, but during the study process we find that we are forgetting something, or we are not taking out we are not using this observation, or we are not putting this patient finding into the Excel. So during the review process it happens. So it's very important to discuss your findings or whatever patient you are taking with some senior, or your research guide, or your mentor, or your thesis guide, so that it should not, because once suppose the data is collected for a year and you have missed some important aspect, then it becomes a problem. So all the important the effort goes in vain. So it's very important that every week or 2 week or 3 week we should review our paper or our finding, so that we are very sure that we are going to get some meaningful interpretation out of it. So, what are the different types of study design in terms of strength of evidence? As this was also discussed in last webinar, so just revising all these things again. So, we have types of study design based on high strength, moderate, and lesser strength. So, randomized control trial stands on the top of the tier. They are the gold standard for testing any efficacy of intervention. Participants are randomly assigned to intervention or control group. So, because it minimizes the bias and gives more meaningful results. Before that, it comes systematic reviews and meta-analysis of RCT. They all form the top tier of the any study design. Systematic reviews, they are the comprehensive summary of all relevant studies on a specific question. Actually, if you see, a systematic review is we can do a systematic review sitting at home, because we have all the papers available online. This is one of the difficult papers, but you don't have to collect too much data or something. Like, you just collect all the papers, bring to mark 2 3 observation, combine them into a meaningful result, and you can put a systematic review. So it's not that difficult, which we feel, but we can always do that. And in a systematic review, you use predefined methods to minimize bias, providing the high level of evidence. Because since it combines all the studies from various centers and various parts of the world, so they form the one of the highest levels of evidence of any study. So meta-analysis again combine data from multiple RCTs or studies to increase statistical power, and then helps in identifying patterns and overall effectiveness of intervention. This you already know. Then comes the prospective study. So always, that's why we always do a thesis in a prospective manner, usually, so that, because it forms, it's a good study with a high strength of evidence, and it has a more value compared to a retrospective analysis. Although the retrospective analysis with the data of long term, like maybe 10 years, 15 years, also hold very good evidence and importance in a study. So prospective cohort study, they follow a group of individuals for over a time to assess the effect of exposure or outcome. Suppose we are studying intervention screening glaucoma patients, and we are going to see how many siblings have developed glaucoma later during that part of the year. So this is the prospective kind of study. They are less prone to recall bias, and though not as robust as RCT. Then coming to the next study designs, which are moderate to low strength, there's case control study, comparing individual with a condition to those without looking back to time in assessing the useful for rare disease but susceptible to recall bias. For example, we did a PTM study or a retrospective analysis, rare disease but susceptible to recall bias. Cross-sectional study is studying a particular population in a time frame, for example, maybe 2 years or 1 year, and they are quick and cost effective, but they cannot establish causation. Mean, over a period of time, we don't know what is going to happen. So we are just taking a sample during a particular point of time, maybe a 2 year or 1 year data, and then assessing the outcome. And case series and case reports, they are also important. They give they are descriptive studies focusing on individual cases or a group of patients, maybe 5 to 10 cases, and useful for generating hypothesis, understanding the disease better, and knowing the rarity or rare findings, but limited by lack of control group, because we cannot generalize those findings. Okay. And expert opinion narrative reviews. There are a lot of journals which they ask you for expert opinion. For example, a commentary. There are a lot of journals with the name of expert review of ophthalmology, expert review of anti-infective therapy, XYZ. So these they will ask you for your expert opinion and reviews, but based on your expertise and broad overview of a topic, but they form a lower level of evidence, and it can be subjective and lack systemic analysis. So this is one of the classifications given in Oxford Center for Evidence-Based Medicine. They have described the studies and divided them into 1A, 1B, 1C, 2, 3, 4, 5 based on the level of evidence. So just like it's self-explanatory. Systematic reviews 1A, and then prospective randomized double-blind control trials are 1B. Randomized single-blind trials are 1C, and 2 are non-randomized controlled prospective study. 3 are retrospective. Fourth one is prospective case series, and fifth one is expert opinion. So this is also one of the classifications for strength of evidence of studies. So what are the basic statistics one should know or learn? So it's difficult to like actually one first important aspect of statistics is basics. We should know what is median, mode, and mean, probability, variance. These are some few basic things we should be aware of. Beyond this, it's difficult to memorize and difficult to, because it's not in our common practice and we are not inclined to it. We are not using it regularly. So, but the basic things we should know. But always keep, as I again say, always keep a statistician look, a good statistician which can guide you about what is wrong, what is correct, how can you modify your study better, and how can we take out those results. Are you going in correct format? Because many of our studies have been guided by statistician by doing a pilot and finding out the strength of the study, and then we have started the study and we publish those paper in very good journals. So a statistician, it's just like a 50% partner in your study, actually, if I mean, I'm not underestimating it. But so there are descriptive statistics like measures of central tendency, mean, mode, and median, and variability in the form of like standard deviation, range. They are essential to summarize data on ocular measurement, demographics, and outcomes. Then importance of p-value and statistical significance. So p-value, understanding p-value is critical because for interpreting the likelihood that the study results are due to chance or not. In ophthalmology, if you like study, a p-value less than 0.05 often indicates statistical significance, that it holds some significance. And then there comes the importance of confidence interval. They provide a range of value within which true effect size or measurement lies within a certain probability. That is that bell curve in which most of the findings lie, like within the 95% of that bell curve. This is important for understanding the precision of the study findings. And then, sorry, so then comes the sample size calculation. And this is one of the important aspects of study, because we are always stuck like what will be the sample, how will we find out, because there are a lot of formulas to find it, and statistician will find the sample size based on the previous studies which have been there in the literature. So determining an appropriate sample size is crucial for ensuring that studies have adequate power to detect a meaningful difference, especially in a rare disease condition or small patient population. So a rare disease with a smaller sample also have a good value, but a common study with a smaller sample will usually have a less strength. So in this way, this is how your sample size holds importance. For example, keratoconus, which has been studied in detail, for example, Fuchs dystrophy, which is studied in detail, finding out, taking out 10 patients and studying them, not going to reach us anywhere. So, for example, finding out a rare disease or maybe a PCV or maybe a pythium keratitis, for example, a lesser sample also holds important because there is a lack of literature, already there is limited literature available online. So, coming to the advanced statistical methods in ophthalmology, which are slightly difficult to understand, but if we delve into it, first time we'll understand them, but later on we'll forget because they are not we are not using them commonly. So, regression analysis is commonly used to explore relationship between variables such as IOP and rise of glaucoma, risk of glaucoma progression. So, regression helps in predicting outcome based on multiple factors. And then comes the survival analysis based on Kaplan-Meier curve and Cox proportional hazard model, which used to evaluate time to event data such as time to progression of diabetic retinopathy. So every disease has a certain pattern and some link to it. So in this way, we should know that if this disease is following in this proportion or this manner. So what kind of analysis has to be applied there? So we should understand this, then only we will be able to understand which this disease or pathology needs which analysis. And then comes the receiver operative curve, which gives us the sensitivity and specificity. For example, OCT or visual field testing in detecting diseases. And meta-analysis, systemic review, they combine data from multiple studies to increase the statistical power and reach broader conclusion, which is especially relevant in ophthalmology practice. So what are the importance of statistics in research and publication? The role of statistics is it enhances data interpretation. If the statistics is not good, and statistics is not solid, robust, it's not going to give us meaningful data. Sometimes what happens when the paper comes to me for a review, they have put that paper for a original article, but the If you see and go the statistical analysis, only the mean mode has been calculated. So it's not going to give any more useful information in that paper. So sometimes the papers are rejected based on only statistical understanding. Sometimes they say, the reviewer says that statistics is not up to the extent or is lacking power for a original study. So there are the specific statistical tools. They provide tools to summarize, analyze, and interpret complex data, making it easier to draw meaningful conclusions. That's why it's important to study at least four, five, or seven, six, five, six parameters of a disease, so that we should get some link or we should get some interpretation out of that data. If we just study like visual outcome of phacoemulsion, but we have not taken the reflection, we have not taken the spherical equivalent, we have not taken the multiple finding. Only just putting visual analysis it's not going to give us any meaningful interpretation. So that's why if we do some study, we should at least take good parameters, at least in the Excel. Later on, we are going to analyze them or not, it's another thing. But beforehand, we should take out the most of the important data, so that we should reach to some good interpretation of that data. So how it also helps in research with statistics, it validates the research finding. Statistical methods allow researchers to test hypotheses and validate findings. Suppose I'm predicting something. For example, is there is a genetic link between keratoconus and fugues, and I'm studying the genetic aspect of keratoconus and fugue, and I'm suggesting that there is a link. If we have 50 patients of fugues and 50 of keratoconus, and there are some genes which are commonly linked in at least 30-40 patients, and this is our hypothesis, and if our statistical findings are matching to it, then it validates our finding with confidence, ensuring rigor in the research process and enable accurate prediction. Thorough statistical models, researchers through statistical models, researchers can predict outcomes and trend, which is crucial in like medicine, economics, and environmental study, and also helps in making decision making. Something, if some intervention, suppose some injection has been given, and we are getting like 80 to 90% of our patients are improving with, and the statistic is supporting that, then we can put that into practice. That suppose that anti-VEGF is improving the patient visual outcome in 80-90% based on statistics, we can use them in decision making or practice. And it ensures reproducibility. Well-documented statistical method enable other researchers to reproduce study, enhancing the reliability of published finding. Sometimes we read a paper and some very good methodology has been put, and statistical methods are very good. We can even repeat that study at our center, giving them due importance that the methodology or the statistical analysis has been taken from that study. So that's why that is the importance of a methodology in a study. It should be it should be robust, it should be clear, it should be correct, and it should give some meaningful, and it should include everything, so that the most important aspect of a paper is methodology and statistics. So if they are correct, your paper is going to get through for sure. Statistics also increase credibility. Statistical rigors add credibility to research publication, essential for peer review journals and gaining scientific recognition. Some very important paper with good statistical analysis, they find place in one of the top journals. So that help the journal also to improve the scientific content and gain wider acceptance. That's the importance of statistical analysis. It guides the peer review, help review to assess the validity and quality of research. That's what I discussed earlier, that the statistical analysis is lacking, is not good, then the paper is definitely going to die out. It's not going to reach anywhere. And it enhances transparency. It improves it shows that your study has been done honestly, correctly, with everything has been put into correct aspects. Allow readers to critically evaluate methodology, ensuring transparency and trust in the findings. Something has been cooked up, some data has been put up into the statistical analysis, and something, it's not going to give you that answer which you are looking for. So a transparent, good study and expected findings. This is how statistical analysis helps to understand that the study better. So that's I already discussed the importance of a qualified statistician and research and publication. So when to involve, I must say the first step is to always contact a statistician before starting a study, or you have some plan in your mind you are going to do, but you want to make it scientifically correct, and with you want to reach to some good conclusion, the first person you should contact is a statistician. So that's how early involvement in research planning, study designing phase involve a statistician in the study design phase, help us to ensure that the study methodology and sample size is statistically sound, which is crucial for achieving a valid result. So I always contact my statistician during the first part of the study, and then I discuss the paper, and then they'll guide you like you should do that, you should do that, we can do that, and this is how the paper progresses to a good stage. Hypothesis formulation and statistical test. Usually, the statistician may not be from the same background. You are contacting a statistician, but he may not be understanding ophthalmic pathology well. So sometimes this lacks hypothesis formulation and statistical test. He will guide you like you can do, and you can, based on his experience, he can, or he or she can guide you by like you can understand this pathology like this, we can apply this and all that. So they help in guiding the development of hypothesis, selection of appropriate strategy, ensuring that studies objective align with feasible analysis method. Sample size calculation, always you should rely on, you can always do yourself also, but just to doubly sure that everything is going right, the right sample size is critical. A statistician going to help you for that, definitely. And randomization and blinding. For studies requiring randomization and blinding, statisticians ensure that these processes are correctly implemented to avoid bias and confounding. So, data collection and quality control. Statisticians ensure the data is collected consistently and systematically, setting up quality control measure to maintain data integrity. So, whenever we are doing a study and we are collecting some data, suppose we have 2-year timeline, you can always send your Excel in between to a statistician and ask him or her the valuable opinion. Like, is this looking correct, or something is lacking? I should do something else, because they'll guide you, because there is a formula, there is a format of filling the Excel also. So how that statistician want that Excel to be filled up, he or she will guide you. So always very important while data collection and quality control. Don't think that you will send the data after collection everything, because the mistakes, your mistakes can be there. You can have mistakes in your Excel, and that can be highlighted initially when you are doing a study. So very important to keep in statistician in loop during the study period and maintain good relationship with the statistician. Data analysis and interpretation, that is totally a good part of statistician. They'll help you during analysis, helping choosing correcting methods, interpreting complex data, avoiding common statistical pitfall. They'll help you to draw graphs. They'll help you to put out some good figure, pie charts, bar graphs, everything. They're expert in that. So they'll help you in understanding that. And this makes your paper or a thesis very robust. And review of statistical reporting. They can review tables, figures, statistical methods, select sections to ensure clarity, transparency, adhering to guidelines, which are essential for publication quality, and respond, and very important, responding to peer review or query. I still remember one of our papers, the queries have come during the results aspect and the statistical aspect, that why this statistics was not applied, how this was applied, and all that, and how the sample. Sometimes the reviewers ask you the basic question, how the sample size was calculated. Then you have to contact your statistician. They'll only guide you, so they can help you to address complex statistical queries or critiques from peer review, because sometimes they are away from our reach, and you have to always depend on them. And this helps to improve the chance of publication into good impact journals. How to calculate sample size? As I already told you, like I usually rely on statistician, but we should understand some basic aspect. So define the study objective, hypothesis, establish what the study is aimed to detect, and set a clear and testable hypothesis. Difference in means, proportion, or association. We can discuss the paper with the statistician. They'll help you to understand, like we are calculating this and we are going to do this. And effect size. Effect size is the minimum difference between group you aim to detect. Larger effect size requires smaller samples and vice versa. And alpha and beta values, setting the significance level. The significance level alpha, commonly set at 0.05, is probability of rejecting the null hypothesis, which is true, representing the type 1 error. So we should know the type 1 and type 2 error. Type 2 error basically is the power of the study, but it should be usually 80 to 90%. So that's why because there are some patients or sample which is going to die out in the end, which is not going to follow your So the power of study is usually kept as 80 to 90% because of the dropouts. So power is the likelihood of detecting an effect when there is one, minimizing the risk of type 2 error. So type 1 and type 2 error is a common language used by a statistician. We should know this. And then using the sample size formulas, different statistical size, like as we know, there are t-test, chi-square test, with specific formulas for specific sample size calculation. A statistician will help you to apply these better. And considering the variability in data for continuous outcome estimate of population standard deviation necessary to determine sample size accurately. So very important aspect of study is whenever we are defining the result or describing the results, we usually miss the sample standard deviation. We don't, somewhere we are written the standard deviation, somewhere we have missed it. So that's how the paper's strength reduces. So whatever your data is, it should be uniform. It should give some should, if there is a standard deviation everywhere, there should be standard deviation. If you are mentioning your results as percentages, you should mention the numbers also. So it increases your output of the study, and it shows the minutes of study how you have wrote that paper. And adjust for, as I discussed, for expected dropout in longitudinal study, adjust the calculated sample size to account for anticipated dropout. Because if we are targeting 130 patients, we are not definitely not going to get 130. Sometimes 20-30 patients are going to drop out. So that's why the samples are always kept slightly higher, so that we can complete the sample size data. And using statistical software, as we always study paper, always in the standard statistical part, it is always written strata 223 or some Windows software was used, or sample size calculation statistical software can help streamline sample size determination for complex design. So this is basically a more aspect of a statistician, but understanding basics of it is important, and always keeping them in loop is important to understand the results better for a study. Parametric and non-parametric tests. So this is how the parametric and non-parametric tests are divided based on one sample or two samples, t-test, z-test, and two samples, individual sample, paired samples. And again, non-parametric have one sample and two sample for individual and paired. So what are parametric tests? Parametric tests are statistical tests that assume a specific distribution data, usually a normal distribution. For example, they are examples of statistical data: t-tests, ANOVA, and Pearson's correlation, frequently used parametric tests. And they require assumptions about the data, such as normality, homogeneity of variance, and interval or ratio level of measurement, and generally more powerful than non-parametric tests when assumption are made, providing more precise estimates. And then the non-parametric tests, they do not assume a specific distribution, making them suitable for ordinal or non-normally distributed data. And for example, their Mann-Whitney test, Wilkinson-Cook signed rank test, Kruskal-Wallis and Spearman correlation. So ideal for small sample size, skewed data, or ordinal level data where parametric assumptions are not made, and they are more flexible and robust for non-normal data, but maybe less powerful and precise compared to parametric. So parametric tests hold more importance compared to non-parametric tests. So, how to choose the journal for sending the manuscript? This is actually, I took this another class earlier. So, how to target a particular journal? It's a very like widespread topic, but I'll try to figure out a few things here. First of all, very important is scope and audience. Suppose we have a cornea paper, and we are putting in a retina journal. It's not going to reach anywhere. So there are few journals which are targeted: retina, journal of retina and vitreous, their cornea journal, the journal of neuroophthalmology. So while preparing in a manuscript or analyzing any study, we should always keep in mind which journal we are going to target. So as last time I always discussed that NLM catalog, you can go there. There are 84 PubMed index journals, 85 PubMed. You can just go through them, and you can understand through the journal name only which journals take what. So choose a journal that align with the topic, focus, and intended audience. This is how the chance of acceptance of a manuscript increases if you target a correct journal initially only. Impact factor, reputation, definitely higher the impact factor, lesser the chance of acceptance, because the chance of acceptance in these journals is usually 10 to 15%. Very difficult to get through those, especially JAMA, ophthalmology. These are like journals with impact factor of 9, 10, 12, 14. any GM 40 or 70, 80 impact factor. So higher the impact factor, higher the reputation of journal, more solid the paper should be. Otherwise, uh, we should know like how by publishing and by writing manuscript, by reviewing the literature, we should know how what is the strength of our paper. Is the strength we should, if you are able to understand that, you are able to target the journal well, and your chance of acceptance increases. Suppose we are describing a common pathology, but we are trying to put it in JAMA, they are going to reject it because it's not of interest to them, because they are having very high quality papers to them, the high quality submissions to them. Publication speed is it's one of the very important aspect of any publication. How quickly the journal answers your query, how quickly the paper is assessed, how quickly the paper is peer reviewed. So usually, if you go into the author instruction, the journal submission to publication time is usually written. Usually, they will write that first report will come in 57 days, 47 days, like that. So this is also important aspect of a journal. So in between, like considering our Indian Journal of Ophthalmology, every paper was given answer in a month. Still, we are now that has slightly increased, but earlier during last 2 3 years, that's why IGO was in boom, because we used to get the answer very quickly in maybe 5 7 days, 10 days, and the chance of if we are not getting that paper in the journal, then we are definitely going for another journal very quickly. So publication speed definitely matters. Some journals take around 1 year. Still remember one published one case report in ocular immunology and inflammation. It took 13 months to produce that paper. So sometimes you have to keep patient. One of our case report in GMS Opthal got published after 2.5 years. Indian Journal of Cancer we got published after 2.5 years. So Oman Journal, and these are few journals which take a lot of time, like 2 3 years. So it tests your patience, but journals with a higher impact, higher the impact factor, higher the reputation, very quickly they will reply to you. That's how we should target these journals. Open access versus subscription is very subjective issue. Usually, open access is limited by funding because they are very costly. So we usually choose for subscription method. But if a paper is open access, the chance of citation and access and reaching to masses is very high. So there are the 10 factors I have listed: aim and scope, journal impact factor, indexing, whether it's PubMed index, Medline index or not, peer review of the journal, how peer reviewed is, single blinded, double blinded, what is the time taken, publication time, acceptance rate. Usually the journal also mentioned the acceptance rate is 10%, 20%. Some journals have acceptance rate of 50%, 40%, but they're rare. Reach of the journal, the cornea journal reaches usually to cornea people, and that's this is how it targets. Check the journal for every publication similar to your research article. Journal restriction and beware of predatory publisher. How to identify predatory publisher? Similar sounding names to the journals which are already there in the PubMed, and like Journal of Ophthalmology, Journal of Open Ophthalmology, the Open Ophthalmology Journal. So these are all sound same, but there are two are predatory. One is the peer-reviewed input impact factor journal. So this is how we identify them. Secondly, the peer-reviewed predatory journals will send you the mails and they'll come into your spam folder usually. They'll tell you that we'll give you the editorial position. You send your CV, we can accept the publication directly through the mails, XYZ. So any journal which is reaching to you directly, beware they are predatory. A very good high impact factor reputed journal will never reach to you. They will expect paper to be get submitted onto the author's portal from the authors. So this is how is the basics of identifying a predatory journal. This we can also discuss. We have discussed in another webinar earlier. And we have two publications on predatory journal also. How to choose a journal for sending the manuscript, and acceptance rate. Be aware of the acceptance rate. High impact journals may have lower acceptance, as already discussed. So balance ambition with realistic. Very important. We should balance our ambition that we have to be realistic. While publication, we have to be very realistic that my paper is not that good. So I have to target a journal which has a fair amount of acceptance and a fair impact factor. So this is how we should always think. A rare finding, rare thing, definitely have a chance of acceptance into a higher impact factor journal. Author guidelines, manuscript requirement, we should be very thorough with them, because usually during the editorial check, before the peer review process comes the editorial check, If the author guidelines are not met, the manuscript requirements are not met, sometimes the editorial board rejects the paper itself, there itself. They are thinking that they are wasting our time. So usually, majority times, 80 to 90% time, the editorial board gives you a chance to revise that manuscript, or something is lacking. They will tell you that this is lacking, you should answer this and send us back. But sometimes a very high impact factor journal, they'll directly reject because they have a large amount of submissions coming to them. Journal metrics are always available on journal's website. You can always look into that. H-index, and SJR factor, site factor, etc. And past publication citation, we should always look into. Suppose if you go into the Indian Journal of Ophthalmology, if you go into the previous publication, you will have around 10-20 years of publications available there. You can go through them and understand how the publication is and how the citations have been. So this gives you an idea that what kind of articles are being cited more, and what kind of publication. Suppose if you type predatory journal, there are around 3-4 publications already in IJO. If you target another same paper, their chance of acceptance reduces because already the journal has 4-5 papers like that previously. So either your paper should be distinct, it should add some value to the literature, or it should be some different topic. So these are the strategies, like research your field, read the recent articles, consider the rankings of the journal, submission guidelines. You should be thorough. Identify the specialized or niche journals or the predatory journal. Seek advice from colleagues, mentors, use journal matching tools. There are journal matching tools available online for Elsevier, for Springer. If you go, you just type on the Google journal finder or journal finder for Springer, it will open up. They will ask you to put your title as well as some abstract. Then a list of 20 or 30 journals will open up, which will help you to identify a journal better. Sometimes you are not able to understand which journal should I choose. Then you can consider these journal matching tool. The only disadvantage of these matching tool is that they will usually suggest journals which have a article processing charge. So you should be very careful, because most of the journals have APCs. So you should be careful and understand and go through the author guidelines on the journal's website. Considering open access option in India, usually we don't consider it. Outside, maybe China, Japan, US, the papers are usually funded, and England, NIH, National Institute of Health, they usually fund these papers, so they are high. That's why the citations are more from West, as well as the open access subscription are more from West, because they are funded by the institutes and the funding is very large. So lakhs of dollars, sometimes lakhs of rupees. So it's very difficult for us in our scenario to get a open access subscription. And compare the publication timelines, whether paper is going to reach to us fast or not, and be realistic, as already discussed. How fast and confidential your work should be published. So every publication has importance as if it's timely published. So they have relevance in rapidly evolving field. Like timely publication is crucial in field like medicine technology, when new information can quickly become outdated. Suppose we are doing some study on a rare disease, but we are taking a lot of time and we are not publishing data for 4-5 years. It may become outdated because a lot of new research may come up in that time frame. So if you have some rare disease or a rare finding, you should try to quickly put it on paper and try to publish it, so that your impact should come in correct time. And faster publications can, suppose in a shorter period you have achieved a lot of publication, it will help you to enhance your research. It will help you to also get a lot of citation, because the citation is a time taking process. So as you grow in your career, the citations will keep on increasing. And uh, more number of publications, shorter period, shows your effort, understand, shows your how well you have been inclined to this research aspect. And it will invite grants and funding opportunities in future, maybe from IJMR, ICMR and all that. And speed is essential for research addressing urgent issues such as public health crisis to inform policy and practice. For example, live example was corona crisis. So we a lot of publications were on the guidelines for cornea guidelines or neurophthal guidelines or maybe oculoplasty guidelines for practice. So this is how it holds importance, timely publication. And some journals have fast track options like expedited reviews and publication critical research. For example, during the COVID period, IGO had the expedited publications, which the publications which had huge impact on the papers. So we had three expedited publication during that period, because we had analyzed. I have discussed that paper last in the last webinar, the impact of COVID-19 non-COVID publications in IGO during last year. So it was a expedited publication published in a month. So this is how fast track publications are. If some paper has a huge impact, the journal or the author or the editor wants it very quickly, so they'll tell you to quickly submit this finding. For example, another paper was mucormycosis multicentric paper. It was expedited publication IGO with currently has 500 citations of that paper, and they have around 64 authors in that paper. So huge impact of that paper. So this is how fast a publication published, a paper published correct time and fast publication has a huge impact in literature in a shorter period of time. And it's confidential handling prevents unauthorized sharing of ideas, especially in competitive fields with patent implication. It protects the intellectual property, and double-blinded peer review is very important, because sometimes single-blinded peer review, the author names are exposed. So sometimes the reviewers can become biased, and the paper rejected at that place. So double-blind peer review is always better. It maintains confidentiality of paper. Data embargoes and preprints. There are a lot of channels or sites where paper comes in a preprint with a full peer review, but the preprint is usually not well. It has come into print, but it's still in not gone through the peer review process correctly. So uses embargoes to control data release timing. Preprint allows sharing without full peer review, useful for rapid dissemination. So a faster dissemination of data, but without a peer review, but it holds less importance. So if you, I think it is by the name of research impact or something like that, you'll have a lot of preprints there on online. If you go, a lot of papers are there, but they'll be mentioning that it's not peer reviewed. And confidentially clauses in submission ensure that journals have strong confidential policy to protect unpublished work and author identity during review. A lot of time the reviewers, the authors' identities are exposed. Sometimes during in the methodology, the institute name is written or some IRB number is written, which exposes that paper, and the reviewer may become biased. So we should be careful of these processes to save our process, because if a paper which has a reach to a good journal and it gets rejected due to some confidentiality, it like kills your effort, and it like you become dejected, because after so much of effort the paper goes out of the loop. So we should be careful. We should not mention institute name. We should be very careful. We should not expose anywhere a surgeon's name or something like that until unless it is required by the reviewer. Another important, how to maximize the number of manuscripts from a single project. So it's very important to understand two aspects of it. One is 10 concepts of a single, like suppose glaucoma screening, or maybe laser PI of glaucoma, for example, and then we are studying the photopsia aspect of it. We are studying the entry chamber depth. We are studying the OCT entry segment OCT parameters. So there can be multiple papers from a single data set. That's why I told, whenever we are putting Excel, we should take all data. Whatever data we have, we can put it. Later on, we can take out multiple conceptual papers out of it. So this is how we can maximize the number of manuscripts from a single project. But we should be very careful that we should not use the same data again and again. Like suppose we have 100 patients, and we have found out ASOCT parameters of before and after laser PI in glaucoma patients of angle closure of 100 patients. Then again, we are taking 50 patients of the same data, and then we are again producing a paper. This is called a salami slicing. We should not do salami slicing. This is how. So salami slicing is unethical. So taking out different concepts from a single intervention is one different thing, and putting dividing the same data into multiple papers is different thing. So we should be very careful. So identify multiple research angle, break down the study into different subtopics or specific research question to explore separately, creating focused manuscript from each angle. Data reuse, perform secondary analysis using the same data to highlight different aspect correlation outcome. That's what we can find out we can analyze the data from other aspect, but we should not analyze the same things again and again. That's very important. Suppose we have published one paper of 100 patients. Now we want to publish 500 patients, but we cannot use the same data again, the 100 patients. Understand? That's how we should not do salami slicing. We should collaborative effort with different expert or department to continue unique perspective, enabling more manuscript diversity and addressing the diverse audiences from various journal with different readership. Suppose we are studying genetic aspect of keratoconus. Then we are studying the epidemiology aspect. So there is one journal of genetics. We can put genetic data into journal of genetics, and epidemiology into international journal of epidemiology, like that. So this is how we can address diverse audience with a single data with manuscript with from different aspects. And very important tip for efficient publication is documenting the method thoroughly. That's why I discussed earlier that writing a detailed method paper can be standalone publication supporting other manuscript and aiding reproducibility. Very important aspect. The manuscript methodology should be thorough. That's why we should always go into methodology of different paper, understanding what is correct, what is not correct. And we should always think critically that whether this is correct or not, because we are doing that same thing in our practice daily. Sometimes the cultures have not been done, but the microorganism has been listed in the analysis. So where are the culture reports? How can we identify the microorganism, for example? So this is how we should critically analyze the methodology and leverage case studies report, highlight unique cases or finding from main project to publish an individual case report of prepare. So we had data of Pythium where we had 30 patients, but one patient stood out with the pediatric Pythium which improved. So we published a unique case report, as well as we took out the we had that same patient in our 30 patient data as well in the main study. So maintaining ethical standards are already discussed, and prepare for review and revision. So anticipate peer review requirement by preparing manuscript with structured response, supplementary data, improving acceptance rate. Whatever has been asked for in the review and revision should address it thoroughly with correct evidence, and the chance of acceptance improves. So, as mentioned, any other topics which I have covered earlier that are useful to postgraduate. When I was a postgraduate, I was wanted to make like I want to publish papers on residency or postgraduate. So, if you we had 14 papers on residency, how ophthalmic education or ophthalmic residence. So we have around 14 papers on residency. Then Pythium was always on my important study list, so I had 18 papers on that. Now I'm trying to loop into artificial intelligence, which is currently in boom. So we have already published another 6 papers coming on artificial intelligence. So this is how whatever is in boom correctly, or whatever interests you, or whatever makes you more inclined. Whenever we are going through a journal, we should, whatever papers we are reading more, we should try to imitate them, or we should try to understand them. This is how. So these are the topics which you can touch: ophthalmic education, some microbial keratitis, or some kind of pathology which interests you on artificial intelligence, like that. Important aspects in writing, tips in writing case reports and case series, another totally different class, but just to jot down a few points. This is how case report should look like: abstract, introduction, presentation, discussion, conclusion. This is the basic format of it. You should always keep this in mind, that you should cram it, that this is how the case report should be. After that abstract, there comes the keywords. This is missing, so you should always mention 3 to 5 keywords. Introduction. An important aspect of publishing a case report is you should always be thorough about the guidelines of particular journal, and you should know that which journal accepts case series, which journal accepts case report. This comes by doing literature review and you can go into the journal website and see. For example, Indian Journal of Ophthalmology case reports take case report in 900 words, but European journal takes into 2000 words. Some journals will say there is no limit. So these journals will give you leverage to write whatever you want to write. But 900 words, you have to restrict. So suppose abstract has to come into 150 words, introduction has to come into 300 words, case presentation has to come into 300 words, discussion has to come into 300 words, and conclusion maybe 2-3 lines. So in this way, you should wrap up your paper. So there should be some meticulous planning. Then introduction, always you can like subdivide into the definition part of the pathology, then the clinical features, then the investigation, the management, the lacunae, and what is this case report is going to add. And obviously the epidemiology, a line on epidemiology, a line on review of literature. Case presentation, that's how we have learned during our residency, how we present a case during history, physical examination, diagnosis, treatment, and management. A case report is very important to understand that some part has some patient has been managed, and we should report that outcome. If we have managed some patient but there is no outcome, it's not going to impact that case report. So a case report, you should have uh, pictures from starting from the intervention to the outcome. Or suppose you are done some surgery, the important aspect of case report is solid and very good images. If we don't have images to evident then we understand there is a lack of evidence. We cannot cook up and anything and write. If there are images and it's your patient data images, definitely that has more impact. So always during a case report, you should understand that starting from the beginning to the end, you should have good case images of the patient from first to last visit. That's how your case report becomes very impactful and has a high chance of acceptance. So I was listening to one previous webinar, I think from Jyotiram Biswas sir. He told the first part I used to, I always look into his images. If don't have good images, I don't even write that paper. So very important aspect. Discussion again comes the important aspect, discussing the epidemiology findings, your findings, comparing it with the previous case reports, and then what are the shortcomings and what is the strength and what this case report adds or how this case report is unique. And conclusion is what this case report is going to add in literature. And references, usually the reference limit is 10, sometimes there is 20 references to a case report. So identify a unique or rare case, select cases which have rare presentation, rare findings, rare outcomes. Literature review is very, very important, because if something is unique or rare for you, may not be unique or rare for another person. So you should be very sure that you are dealing with a unique or rare case. Something which I have seen first time may be a rare thing for me, but not for a person who is already in practice for 10 years. So you should be very sure about that. Literature review in a correct format is very important. Sometimes literature review is not correct. We are going to miss that unique report, and sometimes you submit the paper and the reviewer says this has already been reported in literature, this add nothing to our case report. That's how this is a common way of rejecting a case report. Clear clinical details. You should be thorough in documenting each and every clinical and comprehensive finding of a patient with images, especially images taken correctly, correct format, correct on slit lamp images are always welcomed. You should take on slit lamp. You should not take on mobile or something, because a slit lamp image has a different quality compared to a mobile image. And ethical consideration and consent. Usually, the journals will just ask for whether you have taken the patient permission or data. You have to mention in the end of the case report that patient consent was taken, and sometimes they will ask you to submit the patient consent form. But this ethical approval from the IRB committee is not required usually for case report and case series. Okay, and structured and concise writing, as already discussed, should there is a format flow chart kind of, you should put these findings into that, and then English should be correct, alignment should be correct, grammatical mistakes should not be there, thorough spacing, good spacing, correct punctuations, everything. This is how the acceptance rate improves from a case report. Clinical relevance and discussion, already discussed that how it's impacting the literature, the existing literature. something rare, something unique, something new, something first time, it definitely has a high chance of acceptance to a very good journal. Highlight learning point that were already told. In conclusion, highlight what is a take home message, because sometimes the reviewers don't have a time, they'll just look superficially that how is going to, what is, how it's impacting and how this is adding importance to the literature. High quality visuals and data. Again, high quality images, charts, table visually support clinical stuff. I have reviewed a lot of papers where something is written in the image and something else is written in the table. There are a lot of mistakes in the table. So if you go through them correctly, you'll identify them. So I just end by saying this, that the weakness lies in, our greatest weakness lies in giving up. The most certain way to succeed is always just to try one more time. So don't get dejected when your paper gets rejected. I have one publication which got accepted after in the 11th journal. So there is always a ray of hope. There is all, the sun always rise again. The sun is always going to shine. So always and always be optimistic. Anything which has been written, which has been put on paper as a chance of acceptance, we should just try it one more time. Thank you, everyone.
Excellent, excellent, Bharat. You have done an extremely good job, and you have covered almost every corner of the topic what you have given, an overview you have given. And if anybody postgraduate goes through this, definitely gets a lot of insight of what to, how to deal with this and how to go about, how to drive the way, because it is not that easy to explain everything in one single shot, but definitely you've given a good overview. And I want the Dr. Gopala's opinion also. And also the other members, whoever is part to say anything, you can also say.
Yes, sir. Thank you so much.
And Sudhira madam, you want to say anything?
Sir, very nicely explained and very minor points also in this session you have covered. There are no questions only. Like if we'll proceed with Kiran madam.
Actually, Kiran ma'am, she's not available today. She's busy with
Okay, no problem.
So
Now,
sorry.
another thing is what I am facing with the journal, what they are submitting is we are in the beginning, and what the postgraduates are doing is just they are not, they do not know what is a blinding procedure and what is a blinded article and blinded manuscript and first page or cover page. They just mix everything. They
Yes,
put a lot of things in the manuscript itself, and finally, when you go through that, they give that. And in that aspect, what is your advice for them? Because I already told them several times, but even if I want to hear from you, so that what is the best advice for the postgraduates?
like as correctly highlighted by sir, even I have reviewed a lot of papers from people where a lot of authors have written their names and have sent as papers. So always take help of some mentor, how that paper should be channelized. You're a person who has already published a few articles, who knows the hack of process of publishing, and always before submitting you should always take guidance from some senior if you are unsure that whether I have written correct or is this the correct format. And always please, suppose you are writing a case report, at least read 10 case reports before that from the same journal or any other journal, so that you understand that how this paper has to be channelized. For example, we are going as a postgraduate to write some exam in DNV exam or a MS exam. We see 10 answers before it, or maybe we discuss, or we always see how this answer is to be written. So this is how the same thing is, that you should know how this has been previously published, and because a paper which has been published has been reviewed by some expert, so they wanted that paper in that format. So you have to keep that your paper also in that format. So if your format is correct, if you are if you are dressed well, you are attracted. So this is how, if your paper is very nicely channelized, correctly written, everything lies in place, the you should not give a reviewer a chance to reject it. That's how a paper is accepted. That's how we reduce our error of our submission to get rejected. So we should understand that abstract has to come into totally this words, keywords has to be written after a spacing, title has to be bold, highlighted, there should not be any capitalization. Then comes the introduction, you should give one spacing again. This is how, if the format is correct, the even if the English substandard, the content is substandard, people take it because it looks attractive. The images
Yeah.
look good. the language can always be modified, the content can always be enhanced, uplifted. But if the format is not correct, that shows lack of effort, lack of understanding. Then that has a high chance of rejection. So first and foremost aspect of a case report or a article is proper channelization, correct formatting. If that is correct, the reviewer will give his or his expert opinion. Then he or she will uplift your paper by reviewing it, revising it. Then the chance of acceptance improves.
And the postgraduates, the majority of the times, they upload unnecessary documents. That is,
Correct.
the ethical committee certificate and patient instructions or a consent form for taken from the patient, something like that. They're going on doing it. That is
So that's
something
why
which is a waste.
reading the author guidelines is very important. What a journal is expecting from you. They're not expecting the ethical approval paper. They are just expecting the ethical number. So there that is written very clearly everywhere in the journal. But just we are very casual in reading it, or we are not giving due attention to it. That's why we could tend to do these mistakes. And before that, we doubt should come into the mind that whether this is correct or this is wrong. And if you discuss that doubt, then it's going to wipe out. So the very
Yeah.
important aspect is discuss with your senior or a mentor.
And majority of the postgraduates, they give a wrong references and citations. And when you feed that one, you will not know which style they are using it, and finally end up in something else, and you won't be able to retrieve the article at all. And what is
Yeah.
your advice at this point?
So can you come again, sir? Sorry.
These postgraduates, they give some sort of their references, and when you try to search for them, and you won't be able to retrieve the article, you get something. Particularly PubMed means you won't get it, but
Uh,
even in the Google, and it gives, but it won't be able to retrieve it back as easily as possible. So there is some problem.
Usually what happens, these references are copy pasted from some below average content. So what
Mm.
happens, they have also not checked whether this is correct or not. If suppose the reference has been checked correctly, then they are not going to put it, because if usually what happens, they are going to some Google Scholars, some substandard journal, they will copy paste because it becomes easy to copy paste. Nobody is going to understand whether it's going to be, it is copy paste, reference is copy pasted or not, or some maybe from some book or something. So always that reference can be replaced from a PubMed index reference. So always open PubMed and always take references from that, so that your references are authentic, they are unbiased, and even if somebody is reviewing it or going through them, they are able to find it, and there is a high impact.
Yeah, how do you know the type of style of normally we are using NLM.
Yeah.
So how do you identify was already given, but all Gujarat they give. Finally, how to identify
Usually
that one?
it is written on the journal instructions guideline, author guidelines, which
That is
format.
one.
Yeah, which format they want, whether they want in American medical style, or whether they want in Harvard, they want in Vancouver. Usually 99% it is written there. If suppose it's not written there, go through their papers and then understand which reference they are accepting in which format. And suppose
And
they're
this,
accepting NLM
yeah.
format, then take it in LLM format. Usually, what happens, the journals from US, international journals, they will take it in American medical style. So you should be very careful, because first we have tried in American medical style, then you are going to put it into IGO, which requires NLM. You have to channelize them again. It takes a lot of effort, and there where the usually the paper wipes out, where a lot of effort comes in, because now the graduate feel, oh, it got rejected, now I have to again do them into NLM, again submit in that format. So that is the part where we like. So always we should always try one more time, and we should take, it takes only a few hours, but we should be like, we should if we have that vigor of doing it, we want to do it, then we'll do it. Otherwise, what
Yeah.
happens? Oh, we'll leave it. I'm not going to do it. Or I'm submitting like this. Whatever will happen, will happen. We'll see. Anyhow, it's going to get rejected, or it's going to come back because your paper is not in correct format. So
And
usually Indian journals will have Vancouver, American journals will have usually American medical style. Some journals like maybe this one, GM, this one I had still remember Nepalese Journal of Ophthalmology. I published one case report. They wanted it in Harvard. I had first time done Harvard referencing, so I still remember. So I had to take a lot of effort. It came 2 3 times again. The paper came back just for references. So it takes effort, but once you get through it, then you feel good because your hard work has come to some place now, and it's a PubMed index paper you get always cited. You feel good about it. Your hard work comes gives you some like recognition.
Yeah, last thing I want to share, that is recently I've seen one article is already published in some pediatric journal, and they have submitted to me, and giving a very, very excellent way they were presented. They have changed the data. Our tables are all colored in a different way, different lines, and when I went to
Usually what
authenticate,
happens? Yeah, usually what
yeah,
happens if we do that into some reputed journal, they're going to blacklist us.
no,
So
no, I don't know. Because immediately when I went to the identicate, immediately it has shown a high index, similarity index. When I went checked back, and there is a journal which is already published.
So
So fully
yeah,
we
this
rejected.
is this happens very commonly. What happens?
Uh,
People from JCRS or JRS, they a lot of Indian authors will take concepts from there, and they will do the similar kind of study. So you will, when you will go to the literature, you will see, oh, this study has already been done. But usually the data is different, so the only the methodology is correct, but the concepts have been stolen. So we should be very sure. The only thing is, if the concept has been stolen, but the methodology has been stolen, but the data is yours, then it's okay. But if the paper has been copied and everything, then it becomes very difficult. Then it shows
no, same data, same thing, everything is
then
same.
you should blacklist them.
Only,
Ideally, we
no,
get
only,
blacklisted for them. Yes.
very, very, very peculiar. That is from a medical college. Yeah, I
Yeah.
was surprised.
It happens because we want results in a shorter period because we don't want to work hard for it. We don't want to
Very
understand
cool.
the importance of it, and that's why it
Yeah.
happens. We should not follow this.
So,
You should
very
do.
cool.
See,
Yeah.
I used to see a lot of papers from reputed institute with only limited data, 14 patients, 15 patients. Very rare aspect, but they are doing very good study. So it's not taking a lot of effort. 15 patient data, you can take it out one day. But the concept is robust. So that's what we understand the important aspect publication. Your primary outcome, your concept, your thought has to be very good, so paper has a high chance of acceptance. If you think commonly, then even if you take out 1,000 patient data, it's not going to reach very well. That's how the importance is. Your primary research objective itself should be very good. For example, just
And,
giving an idea of cataract surgery on 3D Ingenuity. So
and
one institute compared the normal phaco with 3D cataract surgery, 12 patient data. Simple study, very good study. So this is how the concept is solid, even if the patient data is less, publication comes as an original article in a reputed journal. So it's not about sample, it's not about patient data, it's about your thought. How good you think, how good your concept is. I always say thought, concept, and action. Once first is your thought, then analyze that thought into a good concept, and then lack of action. Majority have lack of action. Thought and concept constitute only 10 to 20% of a lot of people will give you ideas, but papers will not come out because action is lacking. So 80% is action. Until unless you go and do it and sit and write it, till that it's not going to come in. So thought concept is very easy, but channelizing into action is the part which we lack.
yeah, extremely thank you, sir. You have done an extremely good job, and you have covered a lot of topics in so well.
Thank
And
you.
I don't think this video will be preserved in our archives, and definitely whoever sees this, it gives you some sort of a driving force, because you are giving a lot of inspiration for the youngsters, and
Thank you, sir.
I appreciate you. And with this, we conclude this session, and we
Thank you.
have one more module, and as per your convenience, we'll arrange it in a week or two.
Yes, sir.
So
Yes.
we'll again announce it later point of time. Thank you very much.
Thank you so
Thank
much.
you so much, sir.
Thank you.
Thank you very much. We'll leave. Okay. Thank you.
Good day, sir. Thank you so much. Thank you, everyone.
Very nice. Very nice.
Thank you so much.